everyone. Thank you so much for joining us today. My name is Ellen Taverna. I'm the Policy Officer at the ARC of Massachusetts, and I'm going to talk a bit about some federal updates around the COVID-19 epidemic and what we're doing nationally around advocacy. And so I hope, excuse me, let me just make sure I'm getting my slides going here. Here we go. So I hope many of you are familiar with the ARC. You know that we're an umbrella organization. We have 17 chapter affiliates, and we work with provider, government, and advocacy agencies. And our mission is to enhance the lives of people with intellectual and developmental disabilities, including autism and their families. I just wanted to start the presentation as we've done in other webinars, just to put into context what's going on in Massachusetts around the coronavirus. And so far, as of, I guess, last night, we have almost 19,000 cases in Massachusetts, over 500 deaths, and about 1,747 hospitalizations and almost 95,000 patients tested for coronavirus. So things are escalating in Massachusetts, and so we want to be on top of everything that's happening. We want to make sure that we're continuing to advocate and educate legislators about the needs of our community during this difficult time and this state of emergency. So for today's agenda, I wanted to just review some of the some clarifications and developments around the COVID-19 relief packages, particularly around the third stimulus package. And then I'd like to just go over what we're going to be asking for in the fourth COVID-19 relief package. And then, of course, review the ARC of US's We Are Essential campaign, or starting weeks of action. So we'll have like specific policies that we'll be advocating for each week. And then go over some other federal state updates. And then, during this presentation, if there are questions, I'm going to ask Carrie Mahoney just to help me out. If there's something that you see in the chat box that you want to ask me while I'm talking, feel free. I don't think this presentation is definitely not going to be as long as last week's, so we can make it more of a discussion. We also have Kathleen Rachels, who's been leading our advocacy around education issues. So she's going to talk a bit about that on the state and federal level as well. And I just want to start off by saying that we are so grateful. I mean, we have an incredible team at the ARC of Massachusetts and incredible volunteers that are all helping, especially around this crisis. And we also have this amazing federal team at the ARC of US that has just been an incredible resource. And they're so accessible and wonderful in getting updates. So if I can't answer any questions, I know all of our experts in DC can help. And there's actually a webinar today if you need more clarification around the small business loans in the CARES Act. And that's something that's happening that we'll share on social media, but it's actually at 1 p.m. today. So it's right after this webinar. So, so first up, I just wanted to, so we have, the name of the second coronavirus stimulus package was the Families First Coronavirus Response Act. And I went over this last week, so we don't need to go over what's in it again, but there are some clarifications in addition to the CARES Act, the Coronavirus Aid, Relief, and Economic Security Act, that I just wanted to revisit and just make sure that we are all on the same page of what this legislation says. So as far as there is a provision around allowing people that receive home and community-based services under the 1915C waivers that allows them to have their DSPs direct support professionals assist them during a short hospital stay. So I just wanted to clarify, because this has come up, we've gotten this asked before. This is not something that was COVID-19 specific. This was something that the ARCs have been pushing for a really long time. And it's not about the right to have a DSP accompany a person with this disability into the hospital. It's more about billing practices that permit that a DSP to accompany someone, and that's covered and billed for. So now they're able to do that, but there's not a law that's currently in place that permits people with disabilities to have someone accompany them. And we are arguing that this is certainly a reasonable accommodation under ADA, and it's something that we're looking at the state level, which I'll talk about later. And I think it's a really important issue for our families. But I just wanted to make that clear that that's what the provision calls for in the CARES Act. Another issue that's come up is who gets payments as far as the stimulus payments, which are called recovery rebates. So it covers a lot of people. So there's many people that are eligible, even those who don't make enough money to file taxes usually. However, people who are undocumented, that lack social security numbers, file with an individual taxpayer ID number, or adults who are claimed as dependents are not eligible. So that's the one I think that's most relevant to our community. And as I mentioned last week, the payments are not counted as income and they're not counted as assets for 12 months. So this is really important. So that means that people with disabilities can accept payments without putting their supplemental security income, Social Security, SNAP funds, and other benefits at risk. As far as the amounts that are given, it's $1,200 for individuals, $2,400 for married couples who filed jointly. And then there's a $500 supplemental payment per child under the age of 17. However, as I mentioned before, anyone who is claimed as a dependent on another person's tax return will not be able to obtain a stimulus check for themselves. People with adjusted gross income less than $75,000 for a single individual or $150,000 for married filed jointly are eligible for the full payment. However, it's gradually reduced as your income goes up, and then it maxes out at $99,000 for individuals and $198,000 for couples. And then this was something that happened recently as well, that there's Treasury guidance that allows Social Security beneficiaries to automatically receive payments without filing tax returns, which is great news. We're really happy that that was decided. However, it does leave out a good amount of people. It leaves out those who receive supplemental security income or certain veterans benefits. So they still have to file taxes when they're not otherwise normally required to do so. They have to either have filed taxes in 2018 or file in 2000 or in the most recent filing in 2019 in order to receive the payment. So that is something that we're working on to change. And we've been asking for your advocacy and talking to Congress about that. And I know the ARC of US is working really hard to make a change with the agency, but that is something that's still not resolved yet.
Hey, Ellen, this is Carrie. Christine had a question on that. What's the rationale for treating SSI recipients differently?
There is no rationale. I mean, as far as I know, it doesn't make any sense, especially if they hadn't been required to file taxes before. That's what we're arguing. It doesn't make any sense, and it leaves out, a vulnerable population. So that is something that you're right. It doesn't. There's really no rationale behind it that I know of that makes any sense. Particularly if they're allowing Social Security beneficiaries to automatically receive them, then it would naturally, we would assume that would apply to SSI as well. And as I said, it is something that they're certainly working hard to make this tweak that it will be resolved by the agency. Otherwise, we're pushing for it in the fourth COVID-19 package. But that's an excellent question. I mean, I don't have a good answer to why.
Yeah, Rachel commented that she imagines they use the tax system to facilitate distribution of funds.
What's that? Yeah. I mean, but still, it seems like this is a pretty easy fix for them to make it automatic. But yeah. So for paid leave, I just wanted to clarify a few things as well, because there was recent rule that was published from the Department of Labor that clarified a few things. So this was from the second COVID-19 package that provided Family and Medical Leave Act paid leave, and it gives 12 weeks of paid leave, but it was unclear if it was only for parental caregivers for children whose school was closed. And there was some clarification in a rule on April 6th from the Department of Labor that clarified that it did include parents of adults with disabilities to qualify for the expanded family and medical leave, paid leave offering. However, it still omits paid leave for many caregivers, which of course doesn't work for many of our families that have sibling caregivers or other family members. And it also excludes individuals with disabilities who may be self-isolating because of COVID-19 risks. So they're just limited to that 2 weeks of paid leave. And of course, there's a threat, that they could lose their jobs or have to go to back to work and risk exposing themselves to COVID-19. So this is something that we're certainly advocating to change. As far as education updates, and Kathleen, feel free to jump in, or you can talk later when we're covering state updates. But I just wanted to reiterate that there was this $30.75 billion in education funding, and some of it could be used for IDEA and special ed programs. However, there's a directive in the language that says that the Secretary of Education needs to submit a report in 30 days, which would be by April 26th. And so that means that Secretary DeVos can recommend any waivers under IDEA and other education laws that she deems necessary that would provide flexibility to states and local education agencies during this crisis. And we strongly believe that in the current laws under IDEA that there's definitely enough flexibility to address the crisis, and they do not need to be waived in whole or in part. And there's a national alert that we've have on our website and on social media that we're urging Congress not to adopt any waivers for educational services that are proposed by or could be proposed by Secretary DeVos. She hasn't proposed anything yet, but it's definitely something that we're strongly against, and that we're advocating that there are no waivers at all. And we do believe, and I mentioned this in the last webinar, that I think we strongly encourage, in order to protect the civil rights of students, that we need to increase IDEA funding for states and school districts overall. And so that should be the focus right now instead of waivers. Kathleen, do you want to jump in?
Can you hear me?
Yeah.
Yeah, I can probably follow up in later on with the state, but yeah, that's okay. Yeah, as to some of the advocacy statewide around navigating the nuance of the fact that that the federal government has the option right now. We're on a timeline within that 30 days of putting in for those waivers. So I can address that when we
Okay.
talk.
All right, thanks. Okay, so what is needed moving forward? So this is really guided by the arc of US prioritizing issues for our community. And so what the ARC is asking for is more funding for a Medicaid grant program to support access to home and community-based services. And so, we are extremely concerned about the issue of institutionalization, and we want to make sure we're fully supporting our direct support professional workforce. So this is a top priority for funding for Medicaid grants. And then also personal protective equipment and supplies for direct support professionals. We really believe this is urgently needed to protect the health and safety of our workforce and for our families. And we know that this is an issue in Massachusetts, and even though providers are considered designated essential workforce, I think there's still issues with agencies being able to get PPE and medical supplies they need. And so this is state advocacy that we're definitely prioritizing right now, trying to work with HHS to get enough supplies for home care workers and for providers that serve residential homes. Next up is, of course, as I mentioned before, the paid leave for caregivers. As more people with disabilities lose their usual sources of care, family caregivers are scrambling and they need to access paid leave and sick days to help. And we want to make sure that Congress includes all family caregivers and not just parent caregivers. And then finally, it's the SSI issue. So that's a huge priority right now, and we want to make sure that they have access to the recovery rebates.
Hey, Ellen, Chris had a question, and can you add access to quick test for our workforce?
Yes, absolutely. That is something we're asking for on a state level. That's a great comment. That's certainly something that we're prioritizing. And Leo and Maura are taking the lead on that issue, and we'll talk about it a little bit later. But yeah, that's exactly another top issue for us as well. And then some additional asks. I mean, they're not the top priorities, but very important. Making sure that the medications are covered, so it's not just medications under Medicare, but Medicaid and other health coverage, and then of course the ones that are covered under Medicare that it currently doesn't cover controlled substances, which could include something like epilepsy medication. So this is leaving out a huge number of people with disabilities. So this is an issue that we hope is resolved in the fourth package as well. And then a moratorium on all residential evictions. There's a lot of great housing provisions in the CARES Act, but it still leaves some renters and homeowners unprotected unless there's a moratorium on the state or local level. So we want to see that as a national moratorium. And then finally, the permanent extension of money follows the person. So there's a temporary extension again, and they continue to do that in Congress, but we want to make it permanent, and that's a priority of the ARCs. So I mentioned this on the last call, but I just want to remind everyone that we have our We Are Essential campaign going on, and it's led by the ARC of US, and we have an incredible toolkit with sample social media, and right now we're having themes for our weeks of action, and so these are the themes that are listed below for each week coming up. We want to make sure we're covering all our top priority issues. So please make sure that you click on the link and promote this social media campaign on social media, and We've had, I believe, it was over 35,000 points of contact from constituents to their members of Congress. And so it's really an incredible effort that people are making around advocacy. And we just want to keep the momentum going, because Congress is, of course, just like at the state level, they're hearing from a lot of different constituents on a lot of, countless issues. This is obviously, a huge crisis for people in many different ways. And we want to make sure that our community is really being heard at the top level. And so just remember that hashtag, we are essential, when you do any sort of advocacy on social media. And then these are the action alerts that the ARC has on our top priorities. And then, I mentioned before about posting videos, just any sort of simple short video was really impactful. And then just remember to tag your member of Congress. And as you know, your members of Congress are really active on social media, especially right now. And so they're listening and they're paying attention when they get tagged. Okay, so I just wanted to cover, and this is something that Maura covered extensively in her webinar, and I just want to make sure that this was brought up today as well, because it's a national issue. It's not just a state issue. And so our ARC of US and the ARC of Mass, we're both a part of a coalition. So the Center for Public Representation, other groups in Massachusetts are working together. And then there's a broader coalition of national disability groups that are working together to make sure that the civil rights of people with disabilities are protected, and that states are not discriminating against people with disabilities when they're making medical treatment decisions. And we had a really important win yesterday, because as I mentioned in the last call, the coalition had filed complaints in several different states, including in Alabama, about discriminatory practices. And we had an important win that the state of Alabama withdrew its discriminatory ventilator rationing policy, and instructed hospitals that they cannot discriminate against people with disabilities in accessing treatment. And we really have the HHS Office of Civil Rights on our side, and they have pretty strong guidance against these discriminatory practices. And so we just need to make sure that our states are following this. And we've been working really hard with several other groups on this issue. And you can see that the different letters that have gone out from the Massachusetts group, most recently a letter yesterday to Governor Baker, and then also another letter to the Massachusetts Attorney General's office regarding the Massachusetts Crisis of Standards of Care that was issued on April 7th. So, it's not as bad as Alabama's or a few other states, but we still needed some clarification on the language that we have in Massachusetts. And so that's what we were asking for. And in addition to that, we had sent out an action alert yesterday asking people to write to Governor Baker to address the concerns we have around the standards of care advisory. And so the big ask that that we've requested that they look into is making explicit that all individuals are qualified to receive life-saving care regardless of diagnosis, functional impairment, or ADL needs. And they eliminate triage criteria, which scores patients with chronic but stable underlying conditions, including individuals with disabilities. And they ensure accommodations for people with disabilities of all ages having necessary supports from a designated family member or caregiver or guardian. And we have some other changes in the language and concerns, but those are the top three that we have in our action alert that was sent out yesterday. And I think as of yesterday, there were over 150 people that had responded and sent a message to Governor Baker's office. So keep up the great work. We really appreciate your continued advocacy. And this is, such an important issue for many of our families. And then, of course, I just want to mention the census again. We're doing pretty well as far as the self-response rate in Massachusetts. We're above the national average, which is, I think, was at 46.7 as of yesterday. So we're doing well, but still, we know that there's hard to count communities that have much lower response rates. And so we want to be diligent and active, and under the circumstances we're under, we're limited in what we can do as far as our advocacy. So social media plays such a huge role in it, among other things. So we just want to make sure that people are aware that the Arc of Mass is taking this, sees it as a priority, and we're a designated Census Questionnaire Assistance Center, and we're able to answer any of your questions. We recommend you checking out our website on any census updates, or signing on to our newsletter. But it's an important issue, especially when we think about federal funding and what's to come in the next 10 years, which, the census sets that amount. So thinking of all that's going on, it's such an important issue that we're all counted, and we're getting enough resources for our state. And then, of course, to get out the vote. Yeah, go ahead.
Oh, Ellen, I just wanted to mention that Chris also had a comment about any further thought rehabbing a triage team member in hospital for disability. It was mentioned by a participant in yesterday's Maura's call yesterday, so as a recommendation. Yeah,
and that did go in our letter. It is in our letter to the governor.
Okay, so, and then as of 12 p.m. today, there's been 400 letters sent out.
Oh, great.
To Governor Baker, so keep it up. It's great.
Yeah, absolutely. That's fantastic. Thank you for reporting that, Carrie. No, but it did go in our longer letter, our coalition letter. I know that was a part of it. So thank you for the comment. And then, this is just, I said this last week, but I want to make sure that that's still something that we're all thinking about is voting in November. It's obviously a very important issue as well. And we want to make sure we're getting enough funding for Massachusetts for accessible voting, either by absentee or mail voting. So I'm going to stop here and let Kathleen, unless there's any additional questions. I want to have a chance for Kathleen to talk about some education updates on the state level that she's been working on.
Great, thank you. Can you hear me okay?
Yes.
Okay, good. So yeah, it's been quite a confusing and stressful and emotional last few weeks. Just to backtrack, the Arc of Massachusetts has been, working with other state organizations and partnering stakeholders to advocate for some clarification along this way. And so I have some updates, updated as of yesterday afternoon, to give some clarification for those that aren't really aware. So, the federal guidance around the fact that students with disabilities were entitled to a free and appropriate public education was stated early on. However, it wasn't clear. We weren't getting specific directives from our state, and it led to a lot of confusion, right? So to be clear, that has now been clarified, right? The Federation for Children with Special Needs, along with the Special Needs Advocacy Network, SPAN, the ARC, and Mass Advocates for Children, Mass Families Organizing for Change, just to name a few. Of course, there are many more have been players in this advocacy. And so some of the updates that I have based on a call between Dr. Russell Johnston, who is the Senior Associate commissioner for the Department of Elementary and Secondary Education. He happens to oversee, he's the director of special education for the state. So he convened for the third time, I think, in the last couple of weeks with special ed directors around the state. And he made some important clarifications. You know, we had all been confused. He's calling this now phase 2. He's saying, let's not dwell on this confusion. Let's come together. Let's move forward. And he stated, you know, this is an important shift. He was very clear. FAPE must be provided. All students, you know, early on there was some efforts because of the lack of clear guidance, where districts thought if they weren't providing instruction for all of their regular education students, then they, my words, not theirs, they will be off the hook, so to speak, for providing FAPE to our most vulnerable populations under 22 in school. So it's clear now. FAPE is not going to look like a mimic of what your child's IEP is currently. No changes need to be made to that IEP, but under these really stressful and complex times where schools are really trying to get things in order, it's important that it's not feasible that for instance, a 3 times 30, it may be for your child, but for instance would be, you know, 3 times 30 speech and language might be 1 times 30 right now. And of course that is a little, leads to a little bit of, you know, frustration for families. However, we must take what is offered, and hopefully districts have been reaching out now, if not before when they were sort of advised to, that this Monday and next week, districts should have a remote learning plan in order for students on IEPs. Some updates are that those things can look like resources. Districts have been tasked with allowing families to connect with you know, technology, and of course that has not been equitable on every front, but there have been great gains, and hopefully by now that those things have been worked through regarding free internet or Chromebook distribution and so forth. The IEP need not be changed. So there's no form that needs to be signed that states that this is a different set of circumstances. However, there may be some online portal accessing papers that might need some, you know, approval to use this platform, so to speak. But for the IEP itself, it remains the same. And then there needs to be a delivery of services and instruction. It could be remote, it could be packets, it could be on the phone, through the telephone and all of that. And there needs to be ongoing communication between your child's special education team. So it might look like the teacher reaching out to you to let you know. It might be the district sending you the actual plan. And although student services are going to look different, but that's just the nature of where we are right now. The IEP meetings, one update is IEP meetings, this was clarified, should be held virtually during this time of school closures. And then teachers were directed specifically to be reaching out to families about 504 plans. Another update is that the remote speech and language services had required sort of like a 10-hour training before those services could happen. The update is that they're waiving that 10-hour training so long as the speech and language pathologists within 4 months complete that 10-hour training. So that's another example of a barrier that's been removed recently, and there's guidance to that. And in the call yesterday, the Department of Elementary and Secondary Education provided a toolkit. There'll be a letter going out to families. They're finalizing that letter as I speak. And a letter will be coming out with a lot of these clarifications so that everyone is on the same page. And the Department of Elementary and Secondary Education provided like a blank service plan form template with an example of what things can be filled in for those districts who are still struggling to put together a plan. And there are some things that still remain unanswered. There are some questions still around early intervention, turning 3. Some questions still remain around turning 22. Their timelines. There's currently an emergency regulation that was voted on by the Board of Elementary and Secondary Education. And we can share this, they're seeking public input to this. It's a emergency temporary regulation, but they're going to revisit it at the end of May, I believe, to put it into the regulations as a permanent in cases of emergency type thing. And so when Ellen was talking about the federal impact, and I'm not sure the day we're in, but so Betsy DeVos has 30 days. So she has to create, write this her recommendation. Now it's only her recommendation, but I think we're in the middle of that, somewhere toward the end, but we have probably another week and a half to go. And so some of the advocacy in in the circles that I'm in, and something I would say is for families who still don't feel like what they're getting is appropriate, have those conversations, reach out. If you're not hearing from schools, I think it would be important to let us at the ARC know, but reach out to your school if you have one, Special Education Parent Advisory Council, but don't be afraid to reach out to the teacher directly to find out some clarification. Everyone's trying to work through this. It's getting a little bit better, but there are still some concerns. And so if we collectively rise up and cause the larger conversation it's a nuanced thing in the advocacy. If it's very heavy on what's not working, my personal fear is that the federal government will get that message to say, you know what, this is just too hard. This is too hard. Let's recommend a waiver of IDEA, right? So we don't want that to happen. And again, it's just their recommendation. However, we're still within that window of her report. So that's what I have for MCAS. So the Massachusetts Department of Elementary and Secondary Education had put in for a temporary waiver for MCAS testing. And the legislature is working to override that. It passed the Senate. It has to go through all the proper channels before it makes its way to Governor Baker. But the legislature said, you know what, we're just going to kind of go over the Department of Elementary and Secondary Education and waiver the MCAS testing for the year. So that is where that stands. I hope that was helpful. I probably skipped over some things, but.
Kathleen, Rachel had a comment and a question. She just had her IEP virtually last week, and our current obstacle is getting the IEP finalized formally due to the signatures and such by administration.
Typically they would put together all of the, I would think that they would be able to do it in the normal fashion and update the conversation based on that team meeting and then mail out. But if they're not, see, all districts are doing different things. I know some districts, a few staff are still in the actual buildings and able to do some of that administrative printing. So I will check into that. but I'm glad to hear at least that a virtual IEP meeting was conducted. That's good news. As far as finalizing it, I would hope that they would somehow mail that out to you, but I'll get some clarification around that. Yes, so nobody can be in the, yeah, I see that. Yeah, okay.
Okay, thank you. And then Ellen, Beth had a comment and a question about the triage team member that many local hospitals have. They have an autism navigator at this time, and is that different than a triage team member?
Yeah, so I actually just texted Maura because there was discussion in an earlier draft about what that would look like as far as a triage member. And actually what we are advocating for, so I misspoke earlier, is the surrogate accommodation support for people. So people who need assistance due to their disability have a designated support person with them. And that's separate. So then we're also asking for training of the hospital's triage team on disability. But we are not asking for a separate disability person that's in addition to what hospitals already have, as you mentioned, the autism navigator. So it's more about training for the current teams at hospitals and then asking for support from a family member or a caregiver to be a part of key decision-making and present at the hospital. I know, currently right now which sounds awful, but they're just calling people on cell phone if someone goes in and then they talk to a family member or caregiver over the phone. So we're hoping to get this, given there are proper precautions taken around not the spread of coronavirus, but we are advocating for the presence of someone to support a person with disability at the hospital. So I apologize, that wasn't clear to me going in. So and this is a separate letter that's going out soon, and it's still in draft form.
Okay, thank you. And Deborah made a comment about they need to know guardianship law as well if there's no family.
Right.
And let's see, Lucy, I think this would be for you, Kathleen. Lucy, has the ARC taken a position on waivers of MCAS testing? Hopefully MCAS tests will still be required, but may be delayed. Important to measure progress or lack of it.
The ARC of Massachusetts has not. We've had some internal, discussions around this, and it's also new. I know that there are, there are thoughts around both sides of this, and one thing that I am looking into and not quite clear about is those students who are on a trajectory for the meeting the requirements for graduation with a diploma. I would hope that there's some discussion, and I'll find out an update. That'll be a future update around having students held harmless or case by case scenario around if they were still relying upon that final measure of, some may say unfortunate, some may say fortunate test to meet that competency. It's a hurdle that some students struggle to get over if they really want that diploma, which is another conversation for another day. But I'm looking into that currently. So when we hear that, might be an update for next time.
Okay, great, thank you. And then just Beth did have a comment about that the autism navigators in the hospitals should be identified as resources for triage training because they do a lot of training already, but thank you all for what you do. Thanks, Beth. Anyways, thank you all. I think that's about the end of the questions. I want to thank you all for joining, and Kathleen and Ellen for all that good information. So everybody have a great day and be safe out there. Bye-bye.
Bye.